Hi, welcome everyone to today's presentation, Understanding Medical Necessity Documentation, Module 7 in our course. And I'm so happy to be here today. Again, I'm Tony Appleberg-Parks. I'm a clinical documentation specialist and health administrator from the United States. And I look forward to this topic. Okay, understanding medical necessity documentation criteria. So medical necessity documentation is a critical aspect of health care that ensures patients receive appropriate care while facilitating proper reimbursement for services rendered. So let's cover the key components in medical necessity documentation guidelines and standards for demonstrating medical necessity and the importance of specificity and clarity in documentation. So hopefully by the end of the session, you'll be able to identify the components of medical necessity documentation and apply guidelines and standards and ensure your documentation is specific and clear. So we'll begin with an overview of the components of medical necessity documentation. So medical necessity documentation consists of several key components that together justify the need for medical services and treatments. They include patient history, clinical evaluation, diagnostic testing, and treatment plans. Each component plays a vital role in painting a complete picture of the patient condition and rationale for medical intervention. So let's delve into each of these components in detail, starting with history. Patient history is the foundation of medical necessity documentation. It provides detailed account of the patient's past medical conditions, treatments, and outcomes. Comprehensive patient history includes information about previous illnesses, surgeries, medications, allergies, and family medical history. Accurate and thorough documentation of patient history is essential as it helps healthcare providers understand the context of the current medical issue and make informed decisions. When documenting patient history, be sure to include relevant details that support the need for the current medical. Clinical evaluation involves documenting the findings from physical examinations and assessments performed by healthcare providers. So again, that's observations, measurements, and the healthcare provider's clinical judgment. Proper documentation of clinical evaluations helps justify the medical necessity of diagnostic testing and treatments. It's important to document both normal and abnormal findings as well as any changes in the patient's condition over time. Clear and precise documentation of clinical evaluations ensures the patient's current health status and rationale for medical interventions are well documented. So I'd be more specific on this. It's most important to document any abnormal findings, but also normal findings in previous conditions so that we know if they have improved. Diagnostic tests play a crucial role in supporting medical necessity by providing objective data about the patient's condition. This includes lab tests, imaging studies, and other diagnostics. When documenting diagnostic tests, include the rationale for ordering the test results, interpretation of those results. And it's also important to document how the test results influence the patient's treatment plan and overall care. Proper documentation of diagnostic tests ensures that the need for these tests is justified and supports medical necessity of the patient care. Treatment plans outline the proposed medical interventions and the rationale for these interventions. A well-documented treatment plan includes detail about medications, therapies, procedures, follow-up care. It's important to explain why each component of the treatment plan is necessary based on patient history, clinical evaluation, and diagnostic test result. Treatment plans should be clear, specific, and tailored to the individual needs of the patient, and proper documentation of treatment plans not only supports medical necessity but ensures continuity of care once again and helps prevent misunderstandings or errors in the patient care. One of the common reasons for medication errors, one of the most common issues that we have encountered in healthcare dangers is misdocumentation. Demonstrating medical necessity requires adherence to established guidelines and standards, which are provided by various organizations, including Medicare and private insurers. And once again, because I'm in the United States, I'm using Medicare as an example because I'm not familiar with your regulatory environment, but you can translate that as you see needed. So to ensure consistency and appropriateness of care. It's important for healthcare providers to be familiar with and adhere to these guidelines when documenting medical necessity. Adhering to these guidelines helps ensure that the documentation is sufficient to justify medical services provided and supports proper reimbursement once again. So let's take a look at some of the key guidelines and standards, starting with those from Medicare. Medicare has specific requirements for documenting medical necessity to ensure that the services provided are reasonable and necessary for the diagnosis or treatment of illness or injury. These requirements include detailed documentation of the patient's medical history, clinical evaluation, diagnostic tests, and treatment plans. Medicare guidelines also emphasize the importance of documenting the rationale for medical services and ensuring that the documentation supports the necessity of services provided. Case studies and examples can help illustrate how to apply these guidelines in practice, so we will get into some of those later in the course. In addition to Medicare, private insurers have their own guidelines and requirements for documenting medical necessity. These guidelines may vary between insurers, so it's important to be familiar with the specific requirements of the patient's insurance plan. Proper documentation should include the rationale for medical services supported by patient history, clinical evaluation, diagnostic tests, and once again, specificity and clarity are crucial in medical necessity documentation to ensure that the rationale for medical services is clearly understood, and also that coding is done to the highest level of specificity. Vague or incomplete documentation can lead to misunderstandings, denials of reimbursement, and potential issues with patient care. Tips for improving specificity and clarity include being precise in the description of symptoms, clinical findings, and treatment plans. Using clear, concise language and avoiding jargon or ambiguous terms can help ensure that documentation is easily understood by all parties involved. One major example of that is use of the term history of. History of should be reserved for absolute historical conditions, those that don't exist anymore. To avoid confusion when using the terminology history of this, that, and the other medical condition, it's unclear whether that's a current active condition or whether it truly is historical, so we need to delineate that. Okay, so we're going to talk about a case study that presents an example of poorly documented medical necessity. Well, actually, no, the one that I'm going to give you is a well-documented case, so you'll be able to see what that looks like. So with that, let's talk about Mrs. Smith. Mrs. Smith's 67-year-old female that's presented with chronic knee pain in her right knee, which has progressively worsened over the past 6 months. She has a history of osteoarthritis diagnosed 5 years ago. She reported that the pain is constant and exacerbated by activities such as walking and climbing stairs. She's tried over-the-counter pain medications and physical therapy with limited relief. On examination, she had a noticeable limp favoring her right leg. The physical examination revealed tenderness along the medial joint line and decreased range of motion in the right knee. There was also evidence of swelling and crepitus on movement. The pain was rated 8 out of 10 on the pain scale during activity. She had x-rays of the right knee showing significant narrowing of the medial joint space, osteophyte formation, and subchondral sclerosis consistent with advanced osteoarthritis. An MRI was performed to assess soft tissue structures, revealing torn meniscus and moderate effusion. So the treatment, given the severity of Mrs. Smith's symptoms and the failure of conservative treatments, it was determined that she would benefit from total knee replacement. The procedure was explained to Mrs. Smith, including the risks, benefits, and post-operative rehab plan. She consented to proceed with the surgery. So what was the rationale for medical necessity? The chronic and progressively worsening nature of knee pain, along with a known diagnosis of osteoarthritis, supported the need for further intervention. Her physical findings of tenderness, swelling, decreased range of motion, and high pain levels validated the severity of her condition. Imaging confirmed advanced osteoarthritis and torn meniscus, indicating that conservative measures were insufficient. So the treatment plan was a total knee replacement, which was justified as the next step in treatment due to the failure of conservative therapies and the patient's significant impairment in daily activities. Mrs. Smith's comprehensive patient history highlights the chronic and debilitating nature of her knee pain. The clinical evaluation provides clear evidence of her physical limitations and pain severity. Diagnostic tests support the clinical findings and indicate advanced disease, not amenable to conservative treatment. The treatment plan is well documented with a clear rationale for why a total knee replacement is necessary, ensuring compliance with medical necessity guidelines. So what happened? How did this come out? Mrs. Smith underwent a successful total knee replacement surgery. Post-op documentation indicated significant improvement in her pain levels and mobility. At her 6-week follow-up, she reported being able to walk without pain and had resumed most of her daily activities, demonstrating the positive outcome of the intervention. So what about this? The case study demonstrates excellent documentation of medical necessity. Each component, patient history, clinical evaluation, diagnostic tests, and the treatment plan were thoroughly documented to provide a clear and detailed rationale for the chosen medical intervention. This level of documentation ensures that the medical necessity of the procedure is evident, supports proper reimbursement, and ultimately contributes to high-quality patient care. This case highlights the importance of comprehensive and precise documentation in achieving positive patient outcomes and compliance with medical necessity standards. So, ensuring specificity and clarity in documentation requires a combination of strategies and tools. Healthcare providers can benefit from ongoing training and education to stay up to date with documentation requirements and best practices. Utilizing templates and checklists can help ensure that all necessary information is included and that the documentation is specific and clear, so long as we're avoiding cloning and actually validating those things. Regular audits and reviews of documentation can help identify areas for improvement and ensure compliance with guidelines and standards. Implementing these strategies helps ensure that documentation supports medical necessity and facilitates proper coding and thus proper reimbursement. There are many tools and resources available to help healthcare providers improve their medical necessity documentation. Guidelines from organizations such as Medicare and private insurers provide detailed information on documentation requirements. Checklists and templates, as we mentioned before, and online resources including training modules, documentation guides, also provide additional support and education. Utilizing these tools and resources can help improve your documentation practices and ensure compliance with guidelines and standards. And of course, we're always here to help you. And of course, some of your most important tools and resources are your CDI consultants, your coders, and your experts in the area that can help you learn to document to achieve the right specificity and demonstrate your medical necessity. Okay, so with that, just to wrap it up, let's review the key points. We discussed components of medical necessity documentation, patient history, clinical evaluation, diagnostic tests, and treatment plans, and the importance of adhering to guidelines and standards from your regulatory organizations and private insurers. Specificity and clarity in documentation are crucial. We need to ensure the rationale for medical services is clearly understood and supported. The documentation supports medical necessity, facilitates proper reimbursement, thus coding, and ensures high-quality patient care. So by implementing the strategies and tools discussed, healthcare providers can improve their documentation practices and ensure compliance with guidelines and standards. And I'd just like to say thank you for your attention and attendance today, and open the floor for questions, meaning you are welcome to email me at the provided contact information or leave a comment or question in the chat. Feel free to ask any questions you have about the topics we've covered today. You're welcome to discuss any challenges you might face documenting medical necessity and potential solutions to these challenges, maybe some ideas you have, or if you want some elaboration in any particular area. But this is a great opportunity to share your thoughts. And here's that contact information, and you're welcome to reach out. Thank you. Bye-bye.